Hey guys, I'm Cindi from NCLEX Mastery, and this is
Catherine. Celebrate, school's over. We're here to answer your questions, so go ahead and get those in.
We've been checking out all your graduation caps on the page, and we absolutely love them. Please keep sharing them. We want to see your pride and all your hard work that you put into getting through school. So keep them coming. We also have our journey to the NCLEX, so you'll start seeing some posts from 3 students who are finishing up nursing school, and we're tracking their challenges and their successes and their advice as they prepare to take the NCLEX. One of the great things about joining the nursing community is that we're better when we learn from each other. You'll find that your new colleagues will be your strength on every shift you work, right?
Absolutely. And we know what's on your mind now. So everyone has completed their finals, graduating, looking for the NCLEX. And some of the things that you need to do first are to go to the NCSBN website, take a minute to look at their test plan. They actually have a detailed educator version of the test plan. That's really going to be helpful for you too. They have a candidate bulletin that tells you all of the things that you need to know to get ready, what you need to bring with you, what you don't need to bring with you. The NCSBN site has all of your frequently asked questions. So, what do alternate format items look like? There's a tutorial so you can play with what it looks like in their system a little bit. So that's really helpful. They've got an exhibit item, sound item, all those different things that you can play with. Our simulations do too. But if you want kind of the official feel, they have a quick little tutorial you can go through.
They also have important things for test day. Like they'll tell you how many breaks you're allowed and what you're allowed to bring in with you, which is pretty cool to see. Our app is designed and set up just like the NCLEX categories, so that's a great study tool as well.
The NCLEX site, the NCSBN website, will also give you more information about the CAT, about how the computerized adaptive testing actually works. There's a lot of rumors that go around about how the CAT works. Basically, the adaptive testing is designed to make sure that you're answering the level of question that you're comfortable with. So if you've been answering questions that are too hard for you, the system kind of picks up on that you're guessing and backs the difficulty level back off. If the system sees that you're getting all of them right and getting them right quickly, then it gives you harder questions. And all of that just to make sure that you are a strong, safe, competent nurse. So it's not true that as you answer more difficult questions that you just start to get more SATA items. Like none of those things are true. The system just keeps adjusting back and forth until it finds kind of your sweet spot where you're going to start getting things right.
So don't ever worry about how many questions you have or when the test shuts off. Don't ever worry about the timer. Don't pay any attention to it. Just take each question one by one and slow down and read the question. Take the time to figure out what the question is asking you before you choose an answer. And we've talked about how helpful it is to make sure you read through every single question in an item, and same thing goes for alternate items like exhibit items. Make sure you look at all of the pieces of the patient's file for those questions, just to make sure you don't miss anything.
One of the most common questions that we get from our app users have to do with things that they've missed inside the question, where maybe you didn't read slowly enough to see that it asked who needed additional teaching instead of what actually mattered to the question. So slow down. Take each question for what it's worth. This is not a race. You don't get bonus points for finishing quickly. Very few people actually run out of time. So don't let that be the thing that spurs you forward through the test.
So as many of you know, we have the NCLEX Mastery App. And there are a lot of ways that the app can help you prepare for the NCLEX. So if you have never used our app or our exam program, we have loads of resources for you in our help sections of the app. It's a great place to start. Not sure if it's what you're looking for, you can actually download the NCLEX Mastery App for free and you can check it out. You can also access it on the web. So that's a great way to get started.
We have a free simulation. So if you're not sure if you want to buy either one of our NCLEX simulations, we have a free one of those that you can try too. It has all of the alternate format items that you'll find. So that's a great place to start. And then, so we have the exam program, and the way that we suggest people to use it, and this is a common question, is how to use it, right? So we have it set up so that there's a pretest. And then you use the application over whatever your time period is before your test, right? So if you are testing in 3 weeks, then you divide up our roughly 2,000 questions so that you're doing pretty much an even number every day. And there's lots of ways to split that up. We have study plans. And then when you feel good about where you are with that, with your progress, then you take the post-test, and it gives you a probability of passing. And, it's not a guarantee. And anybody that tells you they've got a guarantee that you're going to pass is a little foolish. But we think we've got a really good beat on things, and we hear from users really, really often about how well they've done, and how their test shuts off in that legendary 75 question stop point.
We see that a lot of you are chiming in and talking about how you're finishing up your programs, and you're sharing our posts, which is really cool. We love that. If you want something extra in addition to what Catherine's talking about, we do have a blog, the NCLEX Mastery blog. Check out the links below. And we should have some links to our blog, which have over 100 articles that can really be helpful, not just for the NCLEX, but for starting out at your new position. You can also subscribe to our YouTube channel and check out our podcasts. We have podcasts as well, and we'll make sure we post those links. Whatever you do to prepare for the test, we have a plan that ends with your chilling out the day before the exam and getting plenty of rest and taking care of yourself. So if you prepare in advance and you take that time, then we're confident that you're going to do really well.
You're not going to learn anything in the last 24 hours before the test that you didn't know the day before. So take that time to just kind of be kind to yourself and get some good sleep. Nobody needs to make 75 life or death decisions on 2 hours of sleep. So go to bed, get a good breakfast the morning of. If you're new to nursing and you're not in that group that's getting ready to take the NCLEX, this app is still for you. People use it to study throughout their whole program. It's set up to go along with your fundamentals course, your parent-child courses, your med-surg courses. So it's great help through your program as well as at the end when you're getting ready for the big test.
Another new thing that we're doing is we have the NCLEX Mastery Program, which is a combination of the NCLEX simulation test that Catherine was talking about, as well as the app, all packaged together. You can get that by going to app.nclexmastery.com. That's a great place to get everything all rolled into one. Should we do some shout outs here? We
Sure.
have people. Let's start at the top. We're just going to say hey to you guys because we see you're on here. So Susan, Brian, who do you see on there?
Anna said she was nervous. Don't be nervous. Don't be nervous. Be prepared. Don't be nervous.
Christina's finishing up her LPN. Congrats. And she's using our PN app. That's awesome. Keep it up. Who else?
Ooh, Sulphur Springs, Texas. Is it warm? It's warm, isn't it? Tell us. It's beautiful here in Iowa.
Let's see who else is on here. We see Wanda. We see your smiley face.
Oh, and Anna loves the app.
Awesome. Hey, I see Daniel Smith too.
Katie, thanks for the shout out.
Awesome.
Lots of waves, lots of thumbs. What can we answer for you guys?
Yeah,
Let us know.
Shoot your questions in and we'll try to answer them as quickly as possible. We really appreciate you joining us.
And if you're watching this after the fact, shoot us some questions then too. We'll come back this afternoon and tomorrow morning and try to get some more questions answered. So if you just need a hot minute to think about what you need answered, then take it and we'll get back to you.
Should we give them some tips about select all that apply?
No, you're completely on your own. We're not giving any tips. Select all that apply questions are, everybody hates select all that apply questions. We hate writing select all that apply questions. Actually, they're really a lot easier to write.
Yep.
But we know that you're going to have trouble. So I hate it. But
I roll my eyes every time I get one.
Yeah, like nobody likes that.
So hard.
But if you'll just take a calm, logical approach to them, right? So you look at each one of the options based on whether or not it is the thing that you need to do for what the question asked, you know? The standard rule of thumb is to treat each choice like it's a true or false. And for the most part, that should be a fine strategy. So you look at the item, you look at the STEM question, and then you look at that one choice and see if it works or not. And if it's not correct, then it's not correct. If it's partly correct, it's not correct. The whole thing has to be right in order for it to be the right answer. So
we have a question about SATA.
We have a question about SATA.
Abby is asking, do any of the select all that apply questions in your app only allow for one correct option, just like the NCLEX?
Yes, so we have some of those in the app now, and then we also have a separate section that is just SATA questions, and there's a handful of questions in there that are either single select or all select. And to be fair, that just gives you a better shot, because then you're not playing brain games with yourself of, well, it must be at least 2, or it shouldn't be more than 4, or anything like that. So look at each choice and just be fair to it, and make sure it's the right thing. Don't get in your head and think it must be at least 2 or it must be at least 4 or whatever. Okay, so it can be all or it can be 1.
So another tip for the test is don't ever skip any questions. Always answer every single question. You have to move on anyway to the next question. But just remember that every question counts for sure. So you want to make sure that you take the time to answer the question that you're given. Do you want to give them tips for multiple choice questions? What can we tell them about multiple choice questions? Because that only has one correct answer.
So multiple choice questions are mostly going to be at what's called the application or analysis level. For the application level questions, the easiest thing to do is to picture yourself at that patient's bedside. Okay? So look at just the stem of the question, picture yourself at that patient's bedside, and what would be the thing that you would see or do or hear or smell? Like, what does the room feel like? Okay? Because most students who say that they don't do well on tests will say, well, if I was at the patient's bedside, then I could get this, right? I've been a clinical instructor for 10 years. That's the most common thing. I could do this if I was in front of a patient. You're probably right. So while you're on the test, kind of take a minute, get inside your own imagination, and pretend that you are at the patient's bedside and trying to answer this question. Then look at the answer choices and see if any of those fit what you already knew. See if that fits what picture you had of that patient, okay? Now, for the analysis level questions, those are the ones that are classic. This is not the best answer. Well, yeah, that's kind of how they are. Which color orange is the most orange? That's really how they are. So take a step back. If it's an airway, breathing, and circulation question, that's a no-brainer, right? If airway is relevant to that patient, then airway is the answer.
Right. So you want to determine that when you read the question. You want to know exactly when you read the question. You want to tip yourself off. Is this an ABC question? Because that's what they're really asking, and that will help you choose the correct answer.
Make sure airway is relevant, though. That's an easy distractor. If airway wasn't relevant to the person to begin with, then that's still not the right answer, right? So make sure it's actually relevant to what you were asked. If you're trying to pick which one is first, that means that all of the things that are listed, all the choices are something that you're going to do. So they're all right? But one of them is actually most important and has to be done before anything else. So take your time, read what it's actually asking you.
So someone's asking how to calm nerves, saying they're really nervous. I would say the best thing is just to remind yourself that in clinicals for the last year and a half, you have been in the position of being the nurse. So don't forget that you've already made decisions and you've already taken care of your patients and made the choice as the nurse. So try not to psych yourself out. That's my advice.
Yeah, I mean, and really, take some time the day before to do some of those relaxing things. Like if you like taking a hike, take a hike. If you're a runner, go for a run before the test, get some good endorphins and things going. Try not to do anything crazy out of the ordinary for you. If you only drink a Coke in the morning, then don't try to drink two, So don't try to over-caffeinate. Don't try to sleep less, do all of those things to make sure that that your nerves aren't more jangled than they already would be.
So switching gears a little bit, somebody's asking about whether or not there's an exam that can give us a prediction of how well someone will do on the exam. We kind of created something like that.
Yeah, so on the post-test NCLEX simulation that we have, when you finish those 75 questions, it's going to give you a probability of passing, right? And it'll also give you just kind of a flat score. So if you got 65 out of the 75 right, it'll tell you that your score is 65, but then it'll also give you a probability of passing based on how everybody else who's taken the test also answered those questions. So it kind of gathers information from all of the people who have ever taken it and says, you know what, based on these folks, you've got a 90% chance of passing. Does that mean you'll definitely pass? Well, no, I mean, it can't, but it's a really, really good indicator. Okay. So if you otherwise feel prepared and you've done what you need to get prepared and you take that and you have this 90% probability of passing, you're pretty square and you're ready to go.
So someone is posting something that they want to know if they can take the test or register to take the test from another country like Egypt. And the answer would be there's some special resources for some extra things that folks outside of the U.S. have to do. But yes, we have a lot of people who are preparing for the NCLEX who are not in the United States. We'll try to find some of those links and post them afterwards if you don't already have them.
If you purchase the premium app, what is included? So, like we said, we have the exam program, that's the app in both of the simulations. But then if you want just the app, we've got roughly 2,000 questions in there. We put in just a fresh 300 maybe last week even. So we're updating it all the time, adding to the rationales. So inside the app, you get tons of great questions covering just anything that you can think of, right? Which is what you want. We've got quizzes over all of your topics. So we've got, a section of practice questions for mental health and a quiz for mental health. You can customize your quizzes. So you can go in there and decide that you want to take a 25-question quiz over pediatrics and OB and create that quiz and do that. Tons of mnemonics, so memory tools that can help you try to remember whatever it is that you need to remember. Whether it's monkeys like to eat bananas for your white blood cell counts. And then we have lots of other resources like lab values, a few skills in there like how to draw lab tests. Podcasts, so you can listen to how to take care of somebody in the operating room while you're on the road and learn something maybe you never learned before. And then you've always got free access to our blog. Like that's something that we do where we're giving you content and tips and advice for free every week. We've got, if you're looking for just stuff to strictly help you with content for the NCLEX, we've got a great acid base blog. We've got a really cool red blood cell one. If you're looking for just more tips and strategies for the test, we've got tons of stuff on that. If you're looking at professionalism and tips for your first job, we've got you covered. So in addition to what you get in the premium app, you get all these free resources. We have this great Facebook community. We have a separate study group in addition to just what we already do on our main Facebook page. So lots and lots of stuff that you can access and use. And when you email us with a question from the app, you get us. We're the ones answering you. So when you email us and say, you know what, I'm not sure that I understand what this question meant. I'm not sure that this is right. I'm not sure that I read it correctly. I just don't understand what this disease is. When you send in those kind of questions, we're the ones that answer you. So in addition to whatever you get in the app, you also get direct support from nurses with a combined experience of roughly 30 years.
And we love hearing from you, so keep those coming too. So we'll do one more question. There's somebody wrote a question about pharmacology. How do you suggest preparing for these? Because you can't possibly know all of the medications.
Oh my God, right?
Which is true. It's true. But there are some medications, if you think about your clinicals, there are some classes of medications that you use over and over and over again. And my advice would be to focus on the medication classes that are most common. That doesn't mean that you ignore all the other classes if you have time to study some of those other classes, like, seizure medications and things like that maybe you haven't seen so often. Those are important too, but definitely know like hypertension meds, definitely know osteoporosis, some of the medications that you see over and over on people's medication lists.
And, one of the things is if it's a medication that's just super foreign to you, there's a great chance that the question's not about that medication. So look at the actual question and the context clues that are in the question. So like if you see a question about adriamycin, but the question itself has to do with a certain kind of cancer, it might just be asking you for general chemotherapy side effects and has nothing to do directly with adriamycin. So if you see a drug that you don't understand, don't lose your mind about it, right? Take a step back, look at the whole question, and see if the question is even asking you about that drug. It might just be asking you about the class as a whole. It might just be asking you about the disease process, and the medication is just kind of part of the question package. So don't get stressed out when you see drugs that you don't remember.
We do have a section just on pharmacology. So if you study in the app, you can specifically study just your medications. So I guess that's all we're going to do for today, but definitely keep posting stuff because we'll try to get around and answer your questions online for a little while. And of course, we always jump in and talk to you guys off and on online anyway. So definitely feel free to post something.
Thanks for joining us. We had a great time.